Welcome to 52 Questions. I'm Shannon Weber, Director of Hive. Every year, Hive answers hundreds of questions from patients, their partners, and providers. And each week in 2018, we're bringing one of those frequently asked questions to you in video format. For this week's question, I'm with Hive's Medical Director, Dr. Deborah Cohan. And this week's question is, what are human milk banks and how can they be helpful for women living with HIV and their infant feeding options?
Hi, Shannon.
Hey there.
So I love this question. So human milk banks are, as the name suggests, banks just like a blood bank, but instead of holding on a supply of blood, they hold human milk. So women who are pumping their milk and have extra donate the milk to the milk banks. The milk banks then pasteurize the milk, meaning make sure that they don't have any sort of infection. And just like cow's milk before it gets distributed to stores. And then they end up making this milk available to women whose babies could benefit from breast milk, but for whatever reason, the women can't produce the milk. And that is either because the woman is living with HIV, or another possibility is sometimes a premature baby is born and the woman's milk hasn't yet come in, for instance. There are other infectious reasons that a woman may not give her own breast milk to the baby. So the process is the milk bank, the women usually are the ones who identify themselves. They reach out to the milk bank and say, I have all this extra milk. Those women get tested themselves for HIV. They get tested for something called HTLV, viral hepatitis. The milk is and those are confirmed negative. Then that milk, usually it's frozen milk, will then be pasteurized, and which is a process that kills any extra bugs, but doesn't destroy the health benefits of the milk. So all the good proteins and antibodies, all of those stay within the milk. And then women will, who need milk for their babies, can then, women or men, I should say, will reach out and the milk bank will then supply it. There are about 25 or so milk banks around the United States and also a few in Canada.
Awesome. And so you talked about how women can donate their milk, but how might a woman living with HIV who has heard the recommendation that in the US she's not to breastfeed her child, but really wants her child to have the benefits of breast milk, how does she access getting this milk?
Yeah, so the way that works, and I know best about the San Jose Milk Bank because that is close to where we are in San Francisco. What we do is we actually write a letter. It's like a prescription that we write on behalf of the baby to the San Jose Milk Bank. And Medi-Cal, which is the public insurance for California, and many other private insurance actually will cover the costs of this human milk, because the thought is that the health benefits are really good for the baby. So that it's worth covering it using either public funds or insurance. And so we write this prescription. And then, at least the way that it works with the San Jose Milk Bank, they actually will ship the milk to women or the families. And then and the other piece I should mention is some hospitals are certified to receive human milk as well. So for instance, here at San Francisco General Hospital, the hospital went through a process to become certified to receive the milk. So we here can actually hold human milk, donated human milk for babies, similar to how the hospital went through a process to get certified to have a blood bank. It's totally analogous, actually.
One other question for you as a follow-up. Breast milk has often been referred to as liquid gold, because it takes so much effort for a woman to pump and store the milk. And then it can be quite expensive if it's purchased from a milk bank. They have all their costs involved with storing, pasteurizing, shipping. So if you're struggling with getting your insurance to pay for it and you see the cost per ounce, it could be startling, and you might consider looking for other ways to get milk. So you can get milk in mom's Facebook groups, trade milk with a friend or family member. And so I wonder if you have any thoughts about that practice of kind of going into your own network rather than using the human milk bank to get breast milk.
Yeah, thank you for asking that. I would say ultimately I don't judge. And I would just encourage that everyone, if they choose to not use a human milk bank, make sure that they involve ideally a healthcare provider so that the woman who is donating the milk gets tested. The other piece with that is, her milk won't get pasteurized if it's just a, kind of she hands her milk over and doesn't work through a milk bank. So I would say my general recommendation is to work through a milk bank. And I also want to be practical and reasonable about it.
Yeah.
That may not be feasible for everyone. So I would say if you're going to go this other route, that you really make sure that the woman has been tested for HIV and viral hepatitis, something called HTLV, and that you talk to her about how she pumped, how she stored her milk, just making sure that she used, as sterile as possible procedures in getting the milk.
Great. Thank you for joining us. And thank you for tuning in. Join us next week where I'll answer the question, what is sperm washing and how can it help men living with HIV have a baby?
Bye.